So, good morning, good afternoon, and good evening, everyone. I'm Sabina Sigdal, moderator for today's webinar. Thank you, everyone, for joining with us today, and thanks to our speaker for the interest and willingness to deliver talk in today's webinar. So we know that COVID-19 pandemic has caused an unprecedented crisis in all the areas, including the education sector, and academic institutions have developed different teaching and learning methods in the time of COVID-19. So in today's webinar, we will be focusing on challenges and responses to the effects of COVID-19 in education sector. So this webinar is the first webinar for the year 2021, and it is a part of One Earth Knowledge Cafe webinar series. So talking about One Earth Knowledge Cafe, I can't move this. Yeah, sorry for the interruption. I got some problem with the computer. So talking about One Earth Knowledge Cafe, it is a collaborative effort of more than 11 individuals representing CIH partners and alumni. And the members are from Asia, Africa, Europe, South America, and North America. And it aims to bring together expertise and network of researchers and professionals from various disciplines, countries, and expertise to enable cross-learning, sharing, and network building. So One Earth Knowledge Cafe has been organizing webinars since July 2020, and it has also designed online courses, and I think it will soon be disseminated among us. So this webinar or this project is supported by LMU CIS through DAD Exit program funded by BMZ. So with this, I also would like to highlight on some of the housekeeping rules. I request everyone to keep yourself muted unless you are speaking, and keep your videos off if you are not presenting. So this session will be recorded and shared. PowerPoint slides will be shared in CIH website. After all the four presentation, we will have Q&A session. So the participant can use the raise the hand option and ask questions directly to the speakers, or they can leave the questions in the chat box and we will address them at the end of all the presentation. So any specific questions to a particular presenter, just for clarification, is limited to 2 minutes, 2 hour, 2 minutes for two questions. So in case of any interruption on the presenter due to the internet, we will wait for a maximum of 2 minutes and move to the next presenter. So the plan for today's webinar is first we'll have introduction, which we already did, followed by a country presentation. Each presentation will be for 10 to 12 minutes for a maximum of 15 minutes. And that will be followed by a Q&A and discussion session. And we have allocated 30 minutes for the last session. So with this, we'll move on to the presentation session. And I'm pleased to introduce our first speaker for the today's webinar. Our first speaker is Dr. Tefera Tedesi. So Dr. Tefera Tedesi is an associate professor of curriculum and instruction at Jimma University, Ethiopia, and a recent Fulbright postdoctoral research fellow in the Department of Counseling, Educational Psychology, and Special Education at Michigan State University, USA. Dr. Tefera received his PhD in Curriculum and Instruction from the School of Education at the University of Queensland, Australia. He is dedicated to higher education, health science, and sports science research with hands-on experience and numerous records of accomplishment in various fields. Moreover, he is an organized academic developer, highly skilled in classroom pedagogical practices and curriculum development, who is versed in increasing student engagement and success, illustrated over 20 years of experiences in academic role both in Ethiopia and Australia. So with this, I pass on the floor to Dr. Tefera. So over to you.
Okay. Thank you very much, Sabina. Just before beginning my presentation, I would like to thank a few people that have really contributed to make me part of this webinar session. First and foremost, I would like to thank Professor Matthias Siebeck, who motivated me to get involved in this monthly webinar. I really very much appreciate his enthusiasm as well as his collegiality in our scholarly works. I'm also grateful to the organizing committee members, particularly Professor Kaja, Leonard, and Sabina for their committed support in making this presentation a reality. Above all, I would like to thank the Center for International Health at LMU just to give us this opportunity to participate and share our professional experiences. Having said this, I would like to go into the presentation directly. Yes, let me share my slides, maybe. Oh,
That's it.
sorry, I went into the wrong part. Okay, it is around here. This one. Oh, sorry.
Okay, okay, see you.
Okay, yes, this is my presentation. In today's presentation, I'm trying to give you a little bit of my reflection on the experience I have had in teaching postgraduate students, particularly PhD students in universities in Ethiopia. Apparently, I'm trying to focus on some of the challenges and the chances I have seen in this teaching experience with the time of the COVID crisis. My talking points follow the following order. Maybe just I'll give you a little bit of the context about higher education in Ethiopia, and then I'll talk a little bit about the existing realities, contextual environment, and then what are really the changed circumstances we have been facing as a result of the COVID crisis, and the major changes will be presented, following with enabling factors, and then I will have a kind of wrap up into the major issues that are really a kind of home take message for our audience maybe, and then I'll have a couple of explanation on the implication of what it means by teaching and learning during the time of crisis. When we see the Ethiopian higher education system, it is organized under the Ministry of Science and Higher Education. And underneath these, there are universities and colleges, and the Higher Education Strategic Center, as well as the Higher Education Relevance and Quality Agencies are the supporting wings. And universities and colleges are really just organized into a public and private type of arrangement. And this is a kind of giving you a bird's eye view into how our higher education system is really organized. When we look into the context or the environment we have, the Ethiopian higher education the Ethiopian government is having an increasing expenditure on education, science, and technology, so that there is a felt need to promote education, science, and technology, and the government is really just spending to the best it can to facilitate that. There is also an improving ICT infrastructure, though it is not as expected to the level of having broader access as well as high level quality. We can say there is an improvement in our ICT infrastructure. The other very fertile ground we have is the higher education roadmap study, which was executed 2 years before, and I was part of that roadmap study as well. And it leverages the need for online education, which was really one of the most needed ingredient during the time of crisis that we have been really just transforming into a digital platform. There is also a public-private partnership, which is really just supporting the environment in a way, facilitating the need to mitigate the need to facilitate addressing the gaps created in our higher education system, apparently during the time of the COVID crisis. Probably understanding COVID and its impact or its crisis may be very important as far as the developing countries are really concerned to know the existing realities. In the existing realities, such as Ethiopia, you may find pre-COVID realities that are really affecting quality in one way or another. Uh, One of the existing reality pre-COVID-19 might be the poor quality of education, which has been really just reported in a number of studies. There are limited resources as being a developing country, probably in sub-Saharan country, resources are very much limited in a comparative terms, I can say. The other issue that has been revealed through different research endeavors was inequality, particularly the gender gap and the inequality between different regions living in different regional states. Some of the places are really very much disadvantaged compared with the other very large regions. And when you look into the institutional arrangements in universities, as far as the postgraduate programs are really concerned, there is a kind of delay in completion of programs. That means efficiency was in question, which was one of the serious problem we have as far as the system is concerned. These pre-existing conditions must be taken into consideration when analyzing issues related with that of COVID, because these in one way or another might aggravate situations in making things to be worse. What has been changed as a result of the COVID-19? Due to the crisis, which is beginning between March and April early, there was a temporary closure of our universities so that we were in a halt of our face-to-face programs. And following that, there was a COVID-19 induced digital transformation. In one way or another, we can call this a kind of forced push towards new technologies, because that was the only sure way to get opportunity for learning to resume in a different alternative. Following COVID, probably primary healthcare has become the normative rule, so that it's becoming the new normal, wearing face masks, washing hands frequently, using sanitizers, and social and personal distancing. So that these are new realities we have been exposed to as a result of the COVID-19 exposure. So, as I have said, one of the very peculiar things we have been through might be COVID-19 induced transformation. This transformation was forcing us to look for possible alternatives to continue learning that has been halted due to the closure of universities. So all students were engaged in remote learning. Remote learning was the option, so that a departure was a must, I mean. If you look into the reality following the COVID-19 induced transformation, probably most students get access to the internet to do their learning. As I've already said in my beginning, the students I have had were postgraduate students, particularly PhD students, so that I can say almost all of them were having internet access, at least in their own institutions. The majority of them have smartphones and used that as a kind of learning devices. Some fortunate ones have almost I can say they do have laptops and a kind of a desktop in their office as well, so that the kind of departure and the kind of alternative learning modality was happened in this kind of digital environment. And this digital environment was supported by some enablers. Probably I may call them a kind of devices that are technological in nature, like our Gmail accounts and Google Meet and other Zoom meeting technologies were really leveraging us in a way to share materials and assignments. one of the very things that enabled us to survive during the COVID crisis, being engaged in a different or in an alternative form of learning than business as usual, which is a face-to-face teaching, was empowerment. So was a kind of tailor-made capacity building trainings that are really leveraging us to survive. The other one is the support services we have rendered for our students and the entire academic community, particularly personal supports, academic supports, and social supports, particularly the use of social media might be in a social support, and the technical supports were so much helpful in making things to happen in a way we are expecting them to happen. The other thing is operationalization of tools for e-learning. Apparently, we were trying to look into the possibility of using learning management system, not necessarily in an online, fully online legitimacy, but in the manner that is having the ability to address the problem which is caused due to the COVID crisis. And software and digital content searching and sharing was one of the enablers. And the other one is the communication tools we have. The tools were really making us to be much more connected with digital or a virtual socialization. Despite all these supports we have, there were virtual challenges faced by students and our teachers as well. Apparently, both students and teachers have technological limitations. What I mean is, uh, particularly on the part of the teachers, I can say some of them do not have previous experience of teaching online or teaching distance students, so that things were happening in a kind of imaginative form. Students have an increased burden. I mean, they were becoming much more accountable for their own learning. They were forced to be an independent learner, which is not the case in the previous scenario. When business as usual was happening in a face-to-face platform, students were really just much more supported by their teachers. However, during the COVID crisis, they were forced to have an independent learning, so that the burden was much more on them. Uh, some of them were also complaining that their online presence was much more demanding than they could imagine learning online. And lots of assignments and submissions were really poured into, because teachers were using the only platform, that is the digital platform, as a mechanism in place to address many of the shortfalls or many of the shortcomings that are created due to the COVID crisis. Teachers had decreased interest in online learning. Some of them have a kind of emotional connection. They would like to have a kind of a face-to-face contact because they have been accustomed to that kind of environment for so long. So this strange environment created a sort of feeling embarrassed with a new platform. There are also challenges due to that reason, a feeling of insecurity and losing emotional contact. There was also a problem of knowledge and attitude in terms of utilizing technologies for the learning purposes. That also aggravated the situation. From the institutional perspective, I can say limited capacity was one of the challenges we have. The capacity we have was very much limited compared with the kind of service we are expected to render. Particularly, we were expected to provide much more support, but the human resource as well as the material resources we have had was very much constrained. And COVID has created a sort of extended program duration, so that it extended the lengthy delay we have to be much more aggravated. And there was a kind of a strategic response failure, so that it was not as such very much organized to know what has to be done and how events must be played out. In addition to this, poor internet connectivity as well as power shortages were also part of the problem. uh, the entire effort we have had reminds me the idea of Larry Cuban, who said in 20 years before, he was really just having a kind of investigation following the happenstance of computers into the classroom. And during that time, he said that, much computers are in a school, but they are not, they are not used for the purpose intended. What it means was that computers were very much sold, but those who are existing in schools were not utilized properly. They are underused. The issue or the implication of this is that it is not only availability that matters. The fact that we have uploaded materials online does not make does not make learning to happen because it requires functioning to be the critical point. Probably the thing reminds me also one additional issue, which is an integrated approach to innovation and change. Change happens much more efficiently and smoothly when the needed ingredients are really there. So that a mere existence of technology or uploading materials may not suffice. And probably the kind of change we have been facing requires further change, particularly in relation to structural change in paradigm. That is what I can take lesson out of the parent tag idea, which is written 25 years before. But the issue is, new paradigm thinking requires restructuring the existing uh, scenario we have without an integrated change in paradigm of innovative thinking together with the structuring. Probably we may end up a kind of not addressing the issue in its full capacity. When I conclude, the COVID has given us some fundamental lessons. One of which is business as usual is not always possible. There are situations like crisis of this kind that obliged us to think of other modalities than business as usual, which is the face-to-face instruction. The face-to-face instruction is always possible under normal circumstance. When crises are happening, we need to be always very ready so that flexibility and adaptability are very much important. We need to take lesson out of COVID that flexibility is required, and we need to survive in a different modality, rendering our services less, otherwise tackling crisis will be impossible. In terms of intervention, particularly for developing countries such as Ethiopia, we need to take account of the pre-existing conditions as having an aggravating factor in combating against the demands of COVID. COVID is a burden, but our intervention must have a double-edged sword that can address our pre-existing condition as well as the demands raised by COVID, without which our intervention will fail. So that we need to take this as a lesson. And in our effort in addressing the crisis of COVID as well as our pre-existing conditions, collaboration is very much important so that the global community can have a profound influence in strengthening our capacity in strengthening our system so that we can have better capacity in preparing our teachers, students, and administrators to be ready for future crises. What is the implication of COVID crisis from the pedagogical perspective? One of the pedagogical implications of COVID crisis might be we need to intensify and diversify our professional development opportunities. It is not enough to have professional development opportunities that can help us to survive under normal circumstance, which is business as usual. But it needs to increase the landscape of professional development to expand into other forms as well. And our equation in intervention must accommodate our students as well, so that students' empowerment must be part of the equation in addressing the crisis of COVID. One of the most important pedagogical implication is using diversified technological tools. I would like to explain a little bit further on this one. By way of saying diversifying technological tools, I'm referring to utilizing digital technologies like Zoom meeting, the virtual laboratories, and the digital libraries like EndNote, for instance. Such devices are really very powerful, and we need to use them even beyond COVID because they can leverage us in so many ways. On the one hand, they are cost effective. On the other hand, they are having several pedagogical advantage. If you see the situation in Ethiopia, apparently the last kind of 7 or 8 years, I can say, new universities and colleges are mushrooming in the country. So that I can say some of the universities and colleges are really deficit in terms of human resource, and probably establishing an outstanding library, establishing a world-class laboratory, maybe resource intensive, and it may not happen in a short time possible. So in the absence of the real laboratory, jumping into the virtual laboratory is the best choice in my view. And it's also cost effective, so that uh, I personally advise to look for digital platforms such as Zoom meeting, virtual labs, and the digital libraries to be accommodated as an important ingredient, not only during COVID time, but even after COVID time, because these are powerful ingredients that helps us most in addressing our pre-existing conditions as well as the COVID conditions. Support must be continued. And at the very end, what I would like to underline is we need to have a kind of framework that is interdisciplinary in addressing the demands we have as a result of COVID-19. An interdisciplinary framework give us a holistic vision, and that is very much required in addressing problems surrounding the COVID demands as well as the demands raised due to pre-existing conditions. I have a couple of questions for you. Probably it's a kind of food for thought. What does student engagement look like in this new environment, particularly for females in the developing countries like sub-Saharan Africa, and how how is how are events played out with for students with disabilities? I'm very sure the story will be much rigorous and have a number of important ingredients if we are looking the kind of engagement of students for this particular group. And the other food for thought might be, how is that really possible to ensure a change in learning platform integrates itself with a change in the teaching role from a teacher to a facilitator of students' learning? These are the materials I have been used in preparing this short talk, and thank you so much for your attentive listening. If you want to contact me, just these are some of my address. Thank you so much.
So much, Dr. Jafira, for providing the glimpse on the opportunities and challenges in teaching university students and offering some practical implications. So, with this, we'd like to move on to the second speaker. She is Sophia Arndt. She is currently in the Department of Pedagogy, Inclusive Education for Children with Behavioral Disorder and Autism in LMU Munich. She is teaching future special needs teacher, and our research is focused on individuals with mental disabilities and challenging behavior. So I pass on the floor to Sophia, and I would like to remind that the time for the presentation is between 10 to 12 minutes. Thank you so much. Over to you, Sophia.
Thank you so much, Sabina. Hi, everybody. My name is Sophia Arndt. I'm a member of the Department of Pedagogy and Inclusive Education for Children with Behavioral Disorders and Autism. That is me trying to translate the name that you can see up there. The official name is in German. So I'm presenting today on behalf of my boss, Professor Markowitz, who is unfortunately unable to attend the event, and also my colleague, Dr. Andre Gomez. And from all of us, we'd like to thank the organizers for putting together such an informative event, and I'm excited for the discussion round in the end as well. I think it's self-explanatory that Corona challenged the whole educational system from the very beginning, adhering to social distancing rules, protecting risk groups, and at the same time trying to create an atmosphere for learning for all students was definitely one of the biggest challenges to our German and the whole world's educational systems within the last decade. Especially after the first round of school closures early last year, staff and students were behind and had to catch up on content that was missed due to a slow and difficult process of adjusting to the new regulations. Nevertheless, and despite all the other worries, I'm convinced it is one of the utmost importance to keep in mind the topic of inclusion. Can you hear me?
Yes, we can.
Okay. So I'm convinced that it's one of the utmost importance to keep in mind the mind of the topic of inclusion and joint education for children and teenagers with and without a disability of any sort. So especially in these difficult times, it's so easy to accidentally leave those in need for special attention behind. And I will try to lay out the challenges schools had to face in the last few months during the pandemic and how those can be and partly were overcome. All right, so the Convention of the Rights of People with Disabilities is an international human rights treaty of the United Nations, which enhances the rights and the dignity of people with disabilities. Within its ratification in 2009, Germany committed to strive towards an inclusive educational system. This is an aim that should be kept a priority, especially in challenging times like the pandemic. So it's important to highlight that inclusion doesn't only refer to children with disabilities, but it also refers to all children at risk of exclusion, and especially within marginalized groups. So this might refer to reasons of gender, sexual orientation, might be cultural and social background, ethnic origin, migration, abusive experience. So the list continues. It includes especially those children though, who are the first to suffer from any changes to the system. So for instance, the massive change we had to observe in the school system within the past few months. But in times like this, or should I say like now, and as I also mentioned before, it's extremely important to ensure that the progress of inclusion doesn't stagnate or even decline as a result of the adjustments. Inclusion of children with disabilities needs to continue and in and through schools for children with special needs. After all, the right for inclusion that I mentioned earlier, so the right for an inclusive education continues throughout the pandemic, and schools need to ensure unrestricted access to education and the support network. Participation must be guaranteed and exclusion should be avoided by all means. So this includes leveling out the disadvantages due to disabilities and making the process of learning as effective as possible for all children involved, while ensuring their health and safety, obviously. So the following few slides, I'm trying to portray an overview over the positives that have been achieved and the opportunities that might have opened up through this. And I'm trying to paint a picture of hope in the next following slides. And this is on purpose. This is how we remind ourselves, as referred in the first presentation as well, and I'm sure as you've all experienced, the huge impact of this pandemic, the huge impact it has had in the past, and it still has and will have in the future on this generation, especially on children. And I'm afraid this impact is quite dark, a quite bleak impact on it. School is a fundamental part of children's lives, and it's the environment that they learn academic content and above all their social skills, so making friends and learn to live together. schools have been closed in several countries because of the pandemic, and this comes at a high price for children and their families. So this was the case in Germany as well. The negative effects of the lack of school tuition has been assessed by several studies, pointing to increased inequalities in educational outcomes. So this is, for example, Saavedra published this year, UNESCO and UNICEF, the World Bank published in 2020, just as a few examples. Learning is expected to continue digitally, but how is digital learning supposed to be effective if school teachers, as we've heard earlier as well, themselves have no knowledge of didactics with technological tools? Additionally to the methodological problem, another huge problem is the lack of equipment in schools, or even more certain homes of low-income students and pupils. This starts with simple things like a quiet place to work or their own room to work in, and includes a computer to work on or a stable internet connection. To avoid this problem, many schools in Germany have prepared small learning packages for their students. So these would include worksheets and activities for the students to work on from home. These were and are still either sent out by post, or they're personally collected by parents, for example. Children who live in a house with their own room, as I said earlier, with parents with an academic background, are well able to continue to develop under those circumstances, I'm convinced. And they've adapted really well, as we've seen throughout the last year. But the reality is that many parents, especially those with low incomes and low levels of education, are unable to help their children with school and homework. So the support is lacking here. Many of those children don't have access to technological devices or a workspace, which excludes them from classes and keeps them left behind. And it's important to keep those factors in mind, but I would, however, like to continue from there and try to focus on a more positive view on things, and try to think what the solutions that schools came up with for the challenges of Corona were and might be. So positive examples can be found across the whole country, and it seems like a lot of, especially the inclusive schools, which I'm focusing on, accepted the challenge that Corona placed on. Important factors to mention in this context are, for example, involving children with disabilities by explaining, oh, I hope you can hear me, my internet connection is unstable. Anyway, I'm just going to continue. So involving children with disabilities by explaining the current situation to them. So especially within children with learning disabilities, it's so important to help them to understand the restrictions and the rules and how to behave respectively. Tending to those children and comforting them, those with difficulties, on a basis of respect and appraisal, but this always applies anyway. Avoiding exclusion from learning experience at all costs. So this is mostly done on an individual level, dependent on the student circumstances and on the teacher's means, for example, by phone calls or earlier mentioned work packages, etc. Then last but not least, I want to mention the implementation of didactic measures that ensure a mix of individualized and differentiated learning to enable participation in classes and successful learning, but also the specific, so also the specialized support tailored to the individual needs. So there needs to be a mix of those two. What would we consider a framework for successful inclusion in times of Corona? So important factors within schools are the time given to and spent with each student, then the cohesion, and this is really important, the cohesion within the teaching staff regarding a concept which is supported by all members of staff. So this must be following the guidelines of the government. So in Germany, both of the Ministry of School and the Ministry of Health. So the cohesion here is this concept must be flexible and based on pedagogical guidelines. The flexible aspect we've mentioned or we've heard in the first presentation as well. I think this just applies to all our lives these days. So down in south of Germany, where we are or where LMU is, are surprisingly well equipped in terms of space and electronic devices. But now is the time to highlight structural deficiencies, so both on a building level and on a functional level. And this is very wishful thinking speaking. And this could lead to the possibility of successfully meeting all social distancing regulations in the future. Now, media and technological infrastructure have to be accessible for all schools, including a decent internet connection to create equal opportunities across the field. And this also covers opportunities for homeschooling, which should be considered a new chance rather than being ignored, and an alternative to traditional means of teaching going forward. Special training sessions, and I think this is a really important aspect, and workshops for teachers are needed to introduce staff to the world of digital teaching, ensuring a level playing field across all schools. So this must be happening across the whole country. And then multi-professional and interdisciplinary teams who are willing to accept the challenge of inclusive education in times like these, in challenging times. This point might be especially challenging to meet considering the shortage of teaching staff, which we also currently have in Germany. But in the long term, skilled personnel is essential, a team covering a range of areas of expertise. So these multi-professional teams are necessary to deliver high quality education for students with and without special needs to ensure the inclusion of each individual. And at the end of the day, it's all about each individual implementing. So each of us implementing inclusion on an everyday basis. Each of the teachers, each of the people in the environment of these children. It's in our power to maintain certain standards and fulfill the criteria of inclusion. So this doesn't only apply to Corona. Let's talk about political measures for inclusion in schools during the pandemic. So schools did receive a governmental package for immediate support to target both the short and the long-term inclusion, but it's important to say that only financial resources that are needed through though. This applies during a crisis as well as in normal times, obviously. For a successful process of inclusion, it's important to engage qualified and dedicated teaching staff, as I mentioned earlier, together with social education workers, remedial teachers, teaching assistants, and other support staff. So successful cooperation, I want to highlight again, is essential to guarantee an effective and supportive learning environment, which is ongoing and individually adapted to special needs and disadvantages. This also includes cooperation with parents to ensure adaptive measures for all personal circumstances in the crisis. So this should also be paid special attention to. And the key to progress here is really working together. And in this will hopefully be one of the fruitful outcomes of this pandemic. So to highlight the importance of working in a team of all involved, politicians, teaching staff, social education workers, teaching assistants, etc., and to lead each individual to ideal learning conditions. By this, and this is me again, very wishfully speaking, Corona will shape our teaching sciences as we know them as a whole. One of the big questions is, can virtual technology for social interaction support inclusion? And we in our team think that's definitely the case. So if you consider the curiosity of children around mobile devices, tablets and laptops, which draw them in with colorful apps and entertaining designs. And obviously there are critical aspects on this, especially in this area, that should not be ignored and have to be kept in mind. But the potential for learning and development through educational apps and programs is huge. These apps can create the feeling of belonging. They can establish encounters with classmates, or as we see it now, for example, on conferences can still happen. They can create the opportunity to play and learn, and they offer multiple chances to regulate and organize the learning process. However, if we focus on students with special needs in particular, it's a fact that technological competencies of students with disabilities can vary widely. So this can quickly lead to exclusion of these students. Using and implementing communication technologies can be considered this generation's key competence though. So this should, pre and post-corona, should be taught in school. Here, it's important to include every child and teenager also or especially those with disabilities, to ensure equal opportunities and the chance to interact online and location independent. Again, and the example of this conference where people Zoom in from across the world. This, I'm convinced, will positively affect their participation, even though it's obvious yet important to highlight that this cannot replace real life social interaction between student and teacher. And that can be seen best in the current lockdowns and school closures, during which every student and every child everybody really longed for normality and personal interaction, not only in schools. And that shows us that technologies can serve as a facilitator for education, but in my opinion, cannot, as of now, replace human interaction in teaching and learning. Now, future directions, and I'm nearly done, future directions of inclusion and the after effects of Corona on inclusion in schools. Corona made us all question the traditional setup of the system, and I'm sure you would all agree, especially in the educational system. It forced us to rethink education and to act immediately, with lockdowns happening from one day to another, basically. However, it also underlined the importance of coherence and the power of working together. It highlighted the importance of our society and showed us how crucial it is to put aside selfishness and help and support each other in times of crisis. Inclusion thrives from social interaction to normalize social cohesion and interaction, to feel the power of the collective and to learn and appreciate the value of it. So I think Corona didn't only lead to this long overdue digitalization, but it also showed and reminded us of what the important values within a society and within social life should be. And as an outcome of this, one could assume somewhat optimistically again that Corona sped up the overall process of inclusion. I'm just going to leave that there. In fact, the social and digital aspects of education influence and affect each other interdependently. So that shows us that our schools are on the right track in recognizing and accepting diversity to deliver high quality and inclusive education, of which every student can and will benefit. All right, now with this, I'll leave you to it. And I thank you very much for your attention. And I'd say I'll hand back over to you, Sabina. Thank you very much.
So much, Sophie, for the helpful overview on the inclusion and sharing the different frameworks in the times of COVID-19. So we move on to our third speaker. Our third speaker is Dr. Rafael Alberto. He is a PhD in mathematics education, and since January 2017, he is a professor of the School of Engineering, Science and Technology at Rosario University. At present time, he is a vice provost for academic affairs of this university. His line of research are mathematics education, teacher training, models of teacher professional competencies, and teacher excellence, social justice in mathematics and technological mediation in education, among others. So we are excited to hear from you, Dr. Rappel. Over to you.
Thank you very much. Buenos dias, good morning for everyone. I'm very happy to be here. I'm very happy also to learn from the experiences from our colleagues from Ethiopia and from Germany. I'm gonna share my screen. The idea of my short presentation, since we not have, only have 10 minutes, is to share with you guys the strategy we have in Universidad del Rosario in Colombia. I call it Universidad del Rosario in times of transformation. My name is Rafael Alberto Mendez, and I'm the Vice Provost for Academic Affairs at Universidad del Rosario in Bogotá, the capital of Colombia. Well, I organize the presentation in these 5 topics, and I want to focus in 3 aspects. The first one is the way we need to transform our practice of learning and teaching in the university, since the coronavirus is showing different topics, in fact, different approximations of new ways of learning. Also, I want to show you how important it is to train and support teachers, since this digital transformation was not planned, let's say, specifically in Colombia. And also, and lastly, I want to show how the universities, we also have a main responsibility through research to impact the country. The reality in all the different countries are very particular. Specifically in Colombia, some of the government strategies are not enough. So universities, we have a very high responsibility in order to be closer to communities, especially with the more vulnerable ones. So let me give you a little bit of context. Universidad del Rosario is this gorgeous university, one of the oldest in Colombia. We are almost 400 years old. It's a medium-sized university, around 12,000 students from most of the disciplines in all the level of education. This is important because we participate in the public debate since the beginning, since the independence of the country, actually. But now we are extremely open to innovation and to digital transformation in order to recognize and respect that we have different student communities now. And it is important in order to organize the learning and the teaching. Okay, so for us, it was an extremely interesting challenge, pedagogical challenge. So we organized in a very short time, very, very fast, a strategy called the playbook, which is a body of knowledge. The playbook is this initiative we have to mark our roadmap for the period of 2020 and 2021. But let me tell you, this also opened a really interesting way of understanding like significant learning. So the coronavirus is inviting us somehow to change and to improve the way to communicate and to work with the students. So the playbook is a digital resource that made a compendium of a very large activities, supported and inspired the activity of our institution. We have a main goal of this resource, and is to share to the community this renewed commitment, not only to learning, but also to research in a framework or flexible academic offer, and the deep interest in the experience, in the student experience and the trajectory of the whole community. This digital transformation now goes beyond the coverage. And it also is about offering different user experiences and promoting different educational environments that favor learning. For example, we have presence in different rural regions of the country, and it was in the past a little bit harder for us to be there. But now with this digital transformation and understanding this new model of HighFlex, we can have a more higher, let's say, presence in the regions. So we want to encourage the whole community to use new technologies that enable educational innovation in order to transform the whole university. Not only the way we teach, but also the whole infrastructure, because we need to be ready to receive students if they want to come back, but also to be justice with the students who cannot go to the university. This is very interesting. This playbook resides the whole university experience. And we are very now like far away from knowledge like the traditional way of learning, you know, like transmission, teacher center. And now we are more open and we understand we need to focus on a more, let's say, a student centered, significant, and active learning. This is very important. For this reason, we also integrated the design with a complete agenda of extracurricular activities. This is something I want to focus because we are very worried about the emotional dimension of the whole community. A student who is sad, who is depressed, cannot learn the way we wanted. So we also need to provide a campus experience that recharge this student experience, okay? We also want to support and offer resources and service to stay mentally, physically, and emotionally in these times. In the university, in Universidad del Rosario, we have a school of emotions, and this is extremely important because sometimes when students were sad, they were not kind of like open and they didn't know all the activities and resources we had in order to support them. Now is more than evident. This playbook also gives us an account of adaptation of the university. It shows us we are very resilient, not only students, but professors and teachers. It's learning and effort to enrich the academic experience in the conception of a mixed semester or year with a responsible presence and a remote access mobility. This is kind of like the motivations of the high flex model. It's high because it's hybrid. We can give the experience, let's say, face-to-face, or we can also have it with remote access. It is more than a connection. We need to think about the experience through the class, through the learning. And it's also support by a creative course designs. Teachers who are very sensitive to the new modality and students who are engaged to this active and attentive task. Well, this is the very like kind of like first motivation we have in order to transform. But the whole, I mean, I cannot go that deeper because I don't have not that much time, but the whole playbook is organized in these 8 categories. The first one is focusing the renewed learning, kind of like understanding there are new ways of learning, or they were always present, but we were not taking them into account. Also, the comprehensive and enhanced training to the whole community, because it's easy to say, yes, we need to change, we need to organize it, we need to transform digitally, but we need to support the community in this training. Also, we need to improve the e-campus and the dynamic student experience. We need to be very open to innovation in internationalization. This is extremely important, and we had very interesting cases of how we have virtual exchange and we can improve the practices due this pandemic. We also need to reinforce professional and digital skills and competences. We also have to focus and have a priority to physical, mental, and emotional health. This is, from my point of view, the most important thing, because this is very hard. It's very hard. In Colombia, it's almost 1 year of lockdown, okay? In different modalities, but it's very hard to realize the way the country is organizing is so hard. Also to focus on this solidarity community. And lastly, but not less important, the fact that everything needs to be open, science for all. Okay. The other thing is that we need to support this training to teachers. So we have this program of teaching and learning in times of transformation. We support all the teachers and we give them all the resources in order to transform the practices. This is a whole and an interesting resource, and they are and they have access to different resources in order to transform themselves. They are organized in 5 different topics: emotionally safe classrooms, pedagogy and didactics, basic and advanced use of ICT, tools for learning and teaching, and to be closer to institutional protocols, because we need to respect and take care. Taking care of ourselves, we take care of others. The other thing is that the reality in Colombia is very hard. And some of the families, they have problems. And the very first thing we need to take into account is that in this digital transformation, as a university, we need to make sure that these 1,200 students, 12,000 students, they have all the digital and technological infrastructure in order to have access to all the resources. So we made sure every single student have a computer and have internet connection. This was a very financial challenge to the university, but we focused all our budgets to students because we needed to make sure they had the proper access in order to have all the resources we want to provide them. So we kind of like frame these in principles of resource optimization, targeting mechanisms to serve the most vulnerable ones, strategic communication to make visible all these economic aids. This is important because as my previous colleague was telling us, this corona is showing us how much we are injustice and how injustice is the whole environment. And lastly, as I was telling you, we also have a responsibility of impacting the country. So we have main and massive projects in order to support and impact Colombia. Some of them, the main 3 ones, are these ones. The first one is the diagnostic test project. The challenge was to carry out more than 100,000 tests in regions together with the National Institute of Health. This was a very interesting commitment to the country. The other one is the convalescent plasma project. The challenge is to develop a clinical study and safety and effectiveness of convalescent plasma to treat patients with COVID-19 in Colombia. And the last one is to improve all the public policy. So the challenge was to understand the way in which the population is mobilizing, with whom they are contacting, and generating reports of epidemiological and georeference information. We use artificial intelligence, machine learning, big data in order to support small governments from rural territories so they can kind of like reorganize the public policies in order to understand better the community. So these are the 3 main topics I wanted to talk. The first one is that we need to be open to a massive transformation to understand learning has to change. Second, we need to support the whole teachers community because we need to be closer to train them and be with them in order to improve their practices. And the last one is that we need to impact the country through research projects. They also invited us, the organizers, to provide a question to the audience. So in order to come back to the universities, to the campuses, I wanted to ask you how the face-to-face learning need to change, because this is showing us students, for example, can learn from their houses with no problem if they have access to a very big set of resources. So how is this returning to the campuses, and how do we need to transform it in order to improve the learning and teaching processes? Thank you very much, Sabina.
Thank you, Dr. Rafa, for the very incredible presentation. So without any further delay, we'll move on to our last presentation for today's webinar, we have Dr. Sam Pingle. Dr. Sam is a senior occupational health specialist and adjunct professor at Indian Institute of Public Health, India, since 2015. He has almost 42 years of working experience in the field of industry and teaching, and he was the former vice president at Reliance Industries Limited India and former associate director at IBM India South Asia. He has been recognized with numerous awards and has several publications. So, over to you, Dr. Sam, for your presentation. Thank you.
Thank you, Sabina, for the kind introduction. And good morning, good afternoon, good evening to my old friends and new friends. Since I'm the last speaker, I have certain advantages. A lot of theory and initial things have been spoken about by other learned speakers, so I will not waste time on that. And I'll focus more on our experiences and this is how I intend to go forward after introduction. These three things, bold from the blue, good, bad, and ugly, and when the going gets tough, what are our experiences? Well, you all have heard about India. Probably you will be hearing more and more now. We are a 5,000-year-old civilization, a largest democracy, a huge continent, subcontinent, you can say, with 29 states, 5 union territories, and 1.35 billion people. We have a fastest growing knowledge industry. Our young population is increasing, and we are a land of paradoxes. We have maximum COVID cases, almost next to United States. And at the same time, we are the pharma and vaccine powerhouse to the whole world. I work with Indian Institute of Public Health, Gandhinagar, which is the first public health university in India. We have various courses and teaching, research projects, consultancy, training programs, etc. is in our portfolio. These are the hats that I wear. I'm a teaching faculty. I'm involved in research and consultancy. I'm also chairing the Committee on Internship and Dissertation for my university. And I'm also the examination controller. So these things will also reflect on the experiences that I share. So when Corona struck in February, March of 2019, it was a bolt from the blue. We were never prepared for it. And all of a sudden a national lockdown was announced. All school, colleges, office shops, everything was stopped. There were no mass gatherings, meetings, conferences, everything stopped. There was travel ban, quarantine, followed by isolation and contact tracing of cases. There was initially 10 weeks of strict lockdown, and it continued, and there was very slow unlocking, you can say. And the educational campuses in the physical form were closed, and they are yet to open. The very strange thing is, every time the opening looks about 6 weeks away, 1 month to 6 weeks away. So today also we feel that after a month we are going to open. And we have been feeling like that for last 10 months almost. That gives us a lot of uncertainty, you can say. So all the institutions were closed and the education was severely hampered. In India, we have more than 320 million students. So 4 million postgraduate, 28 million undergraduate, and 130 and 140 million secondary and primary students in the schools. All university examinations were postponed, school examinations were postponed. Online and blended examinations only for final year students were allowed by the University Grant Commission, which is a controlling authority. And all the competitive examinations for professional courses were postponed, and students in lower classes who were not in the final year were promoted to the higher class based on internal evaluation and past performance. That is how it was happening throughout the country, and naturally there were so many challenges. So we were unprepared, there was no warning, there was no infrastructure for this eventuality. Many students left the campus because they thought they'll come back, but they could never return, and their laptops and other things were in the campus itself. There were a lot of issues with student connectivity, devices, online learning on mobile phone is very difficult. The infrastructure in universities and colleges was also not made for this purpose. So naturally the teaching and learning process was disrupted, the examinations were disrupted. The guest faculty, which is an important form in any university, they couldn't come in for online mode. They could only come and speak in physical mode. So certainly we lost that. And as I said, there is a continued uncertainty, one more month, and things will start to get in fine. Then there are various stakeholders in this situation, students, their parents, faculty and teachers, and also there are students with special needs, which do not get much discussed, you can say. Well, the good part in India is we have been undergoing an internet and mobile revolution for last 4 years with the advent of Geo, the new competitor, and we have the cheapest data in the world, as you can see in this table. And Zoom, Google Meet, and others, initially they offered free access to the educational institutions. And some infrastructure was there because data is cheap, and the access to data was not as difficult as it was earlier. In India, the education structure is such that education is on the concurrent list of federal government as well as states. And both the states as well as the federal government have a role to play. There is a state education department, and there is also a role of politicians, and student CDM is there. So post-COVID, government tried to develop a lot of infrastructures, various portals were started for online education, television channels, direct-to-home TV, radio stations, they were all used for teaching, especially for school students. In India, the ground situation will show you a lot of urban-rural disparity. There is also gender disparity. Only 23% of Indian households have internet access. 16% women have access to mobile internet, whereas 36% of men have access to internet. So you can see the gender gap also. In rural household, the internet access was only 15%, whereas urban households, it is 42%. These are the figures of a survey in 2017-18. And most teachers are also ill-equipped for online teaching because that is not the normal things. So the going suddenly started getting tough. And I'll now come to how we handled the situation. We succeeded, we failed, we stumbled. There were a lot of things and many things. So before we reopen or before we do any activities, initially the university was closed fully in the lockdown. After about 10 weeks, it was open, but then we had the task laid out for us. I was also nominated as the COVID officer for the university. So we had to do health risk assessment before getting any staff members on the campus, any faculty on the campus, leave aside students, that's still not on. Risk communication, the standard operating procedures had to be revised, some remodeling of workplace, canteen or food courts is a big issue. That is where a lot of contact can take place. So that had to be reviewed. Health insurance was a major thing. And of course, now we feel that in the next month, we'll be opening our campus for physical entry of the students, but in hybrid mode. So far, what actions we have taken is online teaching, concurrent evaluation, I'll explain to it. Semester end examinations we have completed. The field work, which is very essential in public health, some of it had to be replaced by online work, especially in case of internships and dissertations. And the new admissions, because this has been a period of 11 months now, and one batch had to be admitted. So the new admission process was also had to be done online, and the teaching also online. So the challenges that we faced and the solutions that we tried to get in. The first and foremost was, since all the teaching was online, the students were coming online, there was no way of knowing whether all students are able to attend or not. So all students are not present in the online class for various reasons. And the internet connectivity is also variables, as students are at different locations and different cities because they have gone back to their homes. So the focus and what we did, so we focused on the students who are available during virtual classroom. The recording of the class was done as is being done now, and it was uploaded on the university website to which students had access. So they could download at their convenience and see what was being taught in the class. Then the faculty had to be more proactive. They have to slow their pace and be repetitive in order to ensure that critical points are not missed out when we're teaching. Then standard internal and concurrent evaluation through tests was not feasible, which is a standard practice because we have concurrent evaluation 40% and semester end examination 60%. So the 40% was not possible in the traditional way. So we developed various options for judging and making students involved and to assess them. So group work and PowerPoint presentations, case studies were given to students which they will prepare and present. Discussion forum was started. We even used WhatsApp groups of the students. And the quiz at the end of the course, article review, giving them some analytical work by giving them some data analysis. Then it was very difficult to see if all the students are attentive or not. So, well, we tried to use students as parallel resources during our online discussions by especially encouraging them on the discussion forum, which was concurrent when we're teaching or discussing. The active students needed some encouragement and the passive students needed some cajoling. And the faculty had to guide the students to relevant articles, databases available and maybe accessible online. And use of chat box in online platforms was used very extensively. Then we also knew that students are under stress. There was a lot of stress due to lockdown and related factors and uncertainty which was there. So online teaching further added to that stress. So we had to develop and modify systems to have flexibility of learning, assessment and evaluation. We strengthened our mentorship scheme in which each faculty member is allocated a small number of students in each batch as mentees. And the mentor faculty has to touch base with mentees beyond curricular matters, reach out with empathy, support and guidance and give them a listening. Yeah. And then last but not the least, the students are preoccupied with corona pandemic situation. So it was on their mind, not their studies. So we had to suitably orient our teaching to connect them with the prevalent pandemic situation, even in our teaching. So in terms of exercises, assignments and teaching, like in our occupational and environmental health, I gave them assignments on occupational health problems and the effect of COVID pandemic on the informal occupations and ask them to prepare on that. Then an exercise on restarting the institution in physical mode, what all we need to do. So that was given as an exercise. So students were made to involve and the corona pandemic was connected with the teaching. Since we are a public health university, it was little easier for us as compared to other universities. These were some case studies which I wanted to discuss, but I don't think we have time right now. So I will skip them. And if there is a time subsequently in question answers, maybe we'll take one of them. But we did conduct semester examination and we had all the problems. So we followed a very simple method. We made it an open book examination, but did not increase the time available to them for write. We said you write on the piece of paper. We will send you the question paper by email. You write on piece of paper, take the photographs, make a PDF and send it to us in the given time. And then that will be evaluated by the student. So they needed internet access only while downloading the paper and only while uploading their answer sheets and not on a continuous basis. So to conclude from our experiences, the online form of teaching will now be an integral form in the post-pandemic, which is a new normal, and there is an important shift in the learning paradigm as we see it now. The learning in the new world will now happen beyond the walls of a classroom. It cannot be only teacher teaching and students listening to him. Both the students and teachers need to revisit conventional roles and responsibilities. The lockdown and post-pandemic realities need a more friendly approach to education. A teacher will have to be available to students like a facilitator or a friend who is ready to help as and when needed. And students also will have to be proactive and take responsibility for their learning. So from studying to learning, that transformation will have to be there. And the conventional teacher will also have to become a facilitator. So I'm thankful to Dr. Leonardo and Sabina, my colleague Professor Mayur, and of course the Center for International Health at LMU. I had a good fortune of spending some time here in the summer of 2009. So I still have very fond and pleasant memories. Thank you so much.
Thank you so much, Dr. Sam, for your informative presentation. So thank you all the speakers for shedding light on the consequences of COVID-19 in education sector and offering key recommendation and approaches that can be used. We know that we don't have any one size fits all approaches, but based on our experiences we shared, we can tailor those to our local needs. So with this, we have come to the Q&A sessions. So far, there are a few questions that have been posted by the audiences, so we'll take some questions. I guess the first question is directed to Sophia. Maybe Sophia can respond to it. It says that the solution you proposed, can that be used for the higher education scenario also? Would there be anything else to be considered in terms of the interdisciplinary? So
So
over to you, Sophia.
I'd say definitely, yeah. It's applicable to all cases of inclusion. I think there is a difference between school and higher education. So school children are a lot more dependent on help in a way. So from the outside, from the parents, so they have to be led to it more so than in universities, for example, where you can expect a certain independence, or the work can happen a lot more independent than in school. So I think this is the difference, but the core of it in terms of inclusion I think is the same. Yeah, that's it.
Thank you. The next question is that
um
we have been saying that returning to the classroom must be a priority and it can be done safely, but how to convince parents to change, to send the children when they are so afraid to do so? I think this question might be to all the speakers. So maybe we can start with Sophia and then followed by Sam and then Dr. Rafael.
Thank you. I think what's important here is clear communication. So clear regulations, so following the guidelines, but then communicating what the plan is of each individual school, because schools do go down different routes and do have different regulations. So I think communicating them really clearly by different ways, through different ways. So say, for example, through email, through WhatsApp, as it was mentioned earlier, through different means that suit all parents, to reach all parents. I think this is really important. And what I think at the same time is important is appropriate alternatives. So this might apply to those parents who really don't feel comfortable for whatever reason. It might be because they're at a high risk group, for example, or for students who were in touch with infected people, for example. So appropriate alternatives for students that for whatever reason can't attend schools or university, or yeah, schools mainly in this case, I think are important to set in place as well. But then also highlighting the importance of school, of face-to-face class to parents that might just do it out of fear. So I think we have to differentiate between the reasoning behind it.
Thank you, Sophia. So any comments from Dr. Sam?
What is most important in this case is risk communication. As Sophia has already said, we need to communicate properly the pros and cons and everything to the parents as well as students both, and we have to take them in confidence. What we are planning to do now is we are planning a hybrid model for initial period. Fortunately, the cases are coming down in India, so therefore the apprehension of the people is also reducing. So not everyone will be allowed to visit the institutions or the campus every day, but maybe we can have some people on some days and other people on other days so that they get a chance. Second is so that there are about 40% students taking in the classroom at any given time so that we can have appropriate distance, physical distancing or social distancing, whatever you call, we can maintain that. And the same interaction and the same class will be uploaded or projected to on the internet live, so that the students who are not there can also see that and see the question answers and maybe sort of participate in that. And then they come on the next day, so there will be special sessions for problem solving at the end, again with the students, wherein they can have some face-to-face interaction with their teachers. So a hybrid model in which not everyone is present on each day. So these are some of the things we are doing, and then remodeling of workplace and then canteen and all those things are there. I need not go into those details because they are common knowledge now. Thank you.
Thank you so much. So, any comments from Tefera? So, here also, I get to see in one questions like we can see that the people with low income are disadvantaged in their education. What is the role of university in Ethiopia, Colombia, and India at this point? What are the planning, the faculties of education to don't let behind these kids? So, maybe we can start with Dr. Tefera and then followed by
Yeah,
Dr. Shyam.
yeah. Maybe as I have said in my previous presentation, the disadvantaged groups needs an additional support so that at the time of this kind of crisis, it's not only addressing the central element, which is the crisis itself, but it needs to look into their inequality, so that our intervention must accommodate the inequality as well as the crisis. Such kind of such kind of double-edged sword or double-edged intervention likely solve our problem, unless and otherwise we are addressing their inequality with our intervention effort. The happenstance of intervention to the crisis does not resolve their problem. So they need an additional intervention together with the intervention we have for the crisis. And in that form, the issue is we need to understand our responsibility as being double. We do have a double responsibility, so that countries like Ethiopia and other developing countries have a double burden in a way to accommodate students' needs, particularly from the inequality point of view, together with just addressing uh, the the crisis itself. And with the idea is we need to have more collaboration, wider networking, and a global type of intervention instead of not necessarily only on at a local level. Probably broader, more global networks are really helpful than narrowing down or networking. Thank you so much.
Sabina, you're on mute.
Okay, thank you. So, any points to add on Dr. Sam or Sophia?
Yeah, this social and income equality is definitely a major issue. Though in my university, we don't have much of an issue because everyone is most of the students being postgraduate students, they're expected to have a laptop or some connecting device. But in society, it's a very, very big issue. There are various efforts which are being done at various levels. There are also a lot of people who are collecting the old mobile phones, old devices, refurbishing them and distributing them to the students. Some states have also started to give it, but then giving freebies will not be the end of it, and that will not be the solution. We'll have to find out a way, another way to that. And I think we need a paradigm shift, or we need something, a game changer in that. Hopefully it will come because technologically India is doing a lot of things in software as well as now hardware also. So hopefully we should be able to do something, but it's a big challenge, and it's a challenge everywhere because these inequalities exist in most developing countries.
I'd like to add one quick point
Sure.
before we
Yeah,
finish,
go on,
if
Sophia.
that's okay. Um, just in terms of universities, and I'm not sure if you all agree with me on this, but I think there are a lot of difficulties that we have to overcome as universities, but also at the same time, I think in the long term, there's a huge chance in this whole process that's happening at the moment because it is bringing the world and universities closer together by online courses, by making courses available online. So people that would have never had the chance to join a course somewhere on the other side of the world now have that chance. And I think this will not only be really beneficial to students, but also will increase overall the teaching quality. I'm convinced because students can choose from more universities now. So there is a certain challenge to us teaching staff to actually provide the content in a way that is accessible to everybody.
Yeah, thank you so much. So, because of the time limitation and time constraints, we have to close the Q&A session. I really apologize that the because of the extended presentation, we have to shorten the time for the Q&A sessions. Thank you so much, speakers, for the good discussion. Though it was for a very short period of time. So with this, we come to the end of the webinar. So before we wrap up the session, I would like to provide a brief overview on the upcoming webinars. Um, so so this is the tentative list, tentative dates and the topic for the webinars in the following months. So we will be organizing on the impact of COVID-19 and social development goals, on climate change, on social views, vaccines and epidemiology and risk communications. Uh, Hope to see you in those webinars too. So with this, I'd like to formally announce the close of the webinar. The PowerPoint slides and webinar recording can be made available in our CI's website. Thank you all the participants and thank you all
Thank you
the
so much.
speakers for sharing your insights and
Mhm.
experiences. Thank you so
Thank
much.
you. Bye.
So hope to
You.
see you another
Mhm.
webinar.
Okay.
Stay safe, stay healthy. Thank you
You
so
see.
much.
Okay. Bye.